Is universal health care a good idea? Because we know, like, the time of Obama came in, Obamacare would help and enable, better price cuts and deal with all these, like, big costs that are happening. And did it do much? I'm not too sure. I know it opened up the insurance market for a lot of people that signed up that are uninsured, but it didn't solve the issue of a better healthcare system, did it?
Yeah, that's correct. It didn't really do anything to the cost or effectiveness. It just kind of signed up more people for insurance for the most part, and then they're kind of stuck paying for it. The government doesn't really pay for it. So you have like all kids or Medicaid or Medicare, things like that. But Obamacare just basically opened up the door for more people to get insurance, but nothing with like cost for the most part.
Nothing better. And is Bernie going to have like a different approach on things? Because you kind of did some research on that.
Yeah. Well, the whole Democratic Party, for the most part, is pushing for like Medicare for all, so a single player system. Bernie's stands out the most out of all of them. I guess it has the most support on the Democratic side than anybody else. I think it's 14 people co-signed it, so that's a lot. I guess in the Senate. I'm not sure how the numbers work, but his is more popular than whoever else's, and that's kind of who. His plan is basically the main plan for the Democratic Party, unless somebody else wins. But I don't see that really happening. But he proposes a medical care system for everybody. So the way we would pay for this is, how you have like income tax, and the federal and state tax your income every weekly or biweekly or monthly. There would be like a Medicare tax for that as well that would be taken off your check, which a lot of people aren't happy about. But if you really think about it, you're paying a large sum for our healthcare anyways, for insurance. That money, instead of going to the insurance companies, it will go, to the government, and they would disperse it as they need. So it's the cost, I'm sure, is going to be a little bit different for everybody. Some are going to pay more than they pay now. Others will pay less. But that's the point of having like a government-funded, healthcare. People are going to pay more. Some are going to pay less, but everyone gets it. And this insurance, it's you're going to be mandated to sign up for it. Everyone's going to be signed up for it no matter what.
So will it be only one insurance company? There's not going to be Blue Cross Blue Shield, or will people still have private insurances?
So this Medicare for All that he's proposing, it's going to tackle like hospital costs, certain medications, doctor visits, all that. But you could also opt in to buy your own private insurance. So like cosmetic surgery, certain drugs, those you could either pay out of pocket for, or you could buy like another insurance to back up, the government funded one, which kind of makes sense. As long as insurance, or let's say as long as Medicare covers like the basics of health, and hopefully it incorporates some prevention into it, I think that's going to be better than it is now, because insurance costs and healthcare costs are just ridiculous to the roof. I don't see it getting any worse, and to be honest, I'm willing to pay a little bit more if I have to, just to get like a flat rate for the next like 10 years, because every year insurance gets increased. You always pay more every year for insurance. Medicare expenses always cost more year after year, and just keeps increasing, keeps inflating.
That, or you hear about like deductibles are increasing, or now it's like my insurance doesn't cover 100%. It's 80-20. So after like, what is it, $5,000, I have to cover that 20%. It's just silly, man. Like, these insurance companies are literally like manipulating little prices. You hear your healthcare system, your hospital is changing its insurances. Like, what's going on?
Right. Like, even like when insurers figure out these costs, they're the ones doing the negotiating, and each insurance does its own negotiation. Each company, they don't have one set price for everything.
Standard.
There's no standard of cost or anything like that. They just negotiate. Certain insurances are going to give you more coverage on medication compared to certain companies that are going to give you more coverage on hospitalization. And there's no medium ground. Everyone just kind of does their own thing and negotiates for themselves. And then with this system, the Medicare for All, there's no copays and no deductibles. It's just that one flat, weekly or monthly or whenever your income is, then you basically get taxed on that. And nowadays there's even like we talked about before, there's different healthcare systems, different insurances. So I have one insurance and I can't see this physician because he doesn't accept my insurance. It's like why? What's the difference? It's insurance. I'm insured. I'm paying for it, but he just doesn't accept it.
Or sometimes you switch your jobs and the physician will basically say, I can't take you anymore because insurance changes.
Yeah.
So that relationship that you just created with the doctor, all the things that he knows you inside out in a way, and like now you can't go see him because he won't take you.
Right.
Like I had this issue with my grandma when she like switched like to like Aetna from I don't know what insurance it was. That's so sad, man.
Right. Medicare for All kind of breaks that gap between somebody with less quality insurance compared to somebody with higher quality insurance. You could go see anybody and everybody. And there's still going to be a private aspect to this. I mean, I guess medical facilities are going to decide on how much to pay each person or each worker or how it's going to work. But the numbers aren't really set yet, or they haven't been announced. It's something that you gotta work with once you become president to have a full grasp on the situation for the most part. But if Medicare for All offers healthcare for all and it's quality healthcare and it cut costs, then why not go for it? Countries like Canada have been doing it, and it's been working out for them. A lot of people complain that there is going to be a lot of wait time, things like that. But I feel like here in the United States, it shouldn't be that big of an issue.
We have the system in check, I feel like.
I feel like it shouldn't be that big of an issue. We have so much growth for medicine and technology that it's going to be way more efficient here than it is everywhere else, just because of all technology and the way we've been doing things. So a lot of times the private sector things are going to carry over to like the government sector.
So definitely if you're choosing your candidate for the next election, if you're able to vote, if you're registered, make sure you choose a person that's for a better healthcare system, because that's a huge issue in America right now.
Yeah, people are profiting off your poor health. That's ridiculous. And there's no regulations. They could charge whatever they want, and no one's going to say anything about
and no one's going to people are going to jail for holding a couple grams of marijuana and stuff, and you got people that are literally profiting off sick people, and these people we can't go after these people.
Right.
That's so sad, man.